Welcome. This webcast is designed to walk you through the process of customizing and drafting your objectives for the statewide medical and health exercise. This exercise, as with all HSEEP consistent exercises, is objective-driven, which is why we will cover the objectives here first as you begin to plan your exercise. To find objectives, go to the home page of the California Statewide Medical and Health Exercise website and click on the orange button on the left-hand side that says Objectives and Scenario. There are 11 categories of objectives that are discipline-specific, ranging from hospital to law enforcement. These are samples. They can be customized for your organization or replaced altogether. They are meant as a starting point for your organization. They can be downloaded individually as Word documents or altogether on a zip file. If your discipline does not yet have sample objectives listed, we recommend starting from a discipline that is close to yours in scope, size, and practice. For example, a community mental health center may want to use the behavioral health services or community clinic objectives to start from and customize as needed. We always encourage feedback as well, so if you have requests for other disciplines or suggestions, feel free to contact us on the Contact tab. You'll notice that the first portion of the document is grayed out and provides information on how to use and customize the objectives. Please make sure to read this text thoroughly.
We will now familiarize you with the layout of the document. The flow moves from applicable capabilities to proposed objectives related to these capabilities, to sample tasks within each proposed objective. Any of these elements can be altered as you need, but we recommend reviewing to ensure that your capabilities, objectives, and tasks are aligned with each other and test your gaps effectively. As one example, the first page in the 2017 Hospital Objectives document has the applicable capability Healthcare Preparedness and Response Capability number 1, Foundation for Healthcare and Medical Readiness listed. There are two objectives in this document aligned with this capability, Objective 9 and 10. We will read Objective 9 as an example. The Logistics Section Chief will send at least one resource request through the Medical and Health Operational Area Coordinator, MOAC, and will communicate resource needs with Healthcare Coalition partners to identify available assistance. Then there are 1 to 3 sample tasks for each objective. For Objective 9, these are the sample tasks. Number 1, confirm communication and data interoperability for Healthcare Coalition partners. 2, provide emergency management and ICS expertise and assistance to Healthcare Coalition partners in their response. 3, activate plans and mutual aid agreements to obtain, share, and/or return Healthcare Coalition resources as appropriate, going through the proper resource request and resource demobilization procedures. These tasks, objectives, and capabilities are only guidelines and can be altered to fit your needs. Each objective should follow the SMART format: specific, measurable, assignable, realistic, and timely. Objectives and tasks should specify who is responsible, the timeline for completion, and give you enough details that assigned personnel can begin immediately. As you can see, the objectives continue in this format for the remainder of the document. Other discipline-specific documents have the same format customized specifically to the needs of different participating organizations and agencies. All applicable capabilities were selected from the National Core Capabilities, the Healthcare Preparedness and Response Capabilities, or the Public Health Emergency Preparedness Program, FEP capabilities. These are not prescriptive, rather they're meant to provide a starting point. Numerous samples have been created to provide you with options, but according to FEMA, 10 or fewer objectives are recommended for a functional exercise. These are meant to be cafeteria style. You may decide to choose your own objectives based on your organization or agency's identified areas for improvement in prior exercises and incidents. If you aren't sure where to start, ask yourself, what do we need to work on? What are our gaps? Once you have convened an exercise planning team within your organization, bring a draft of the objectives to your concept and objectives or initial planning meeting to generate feedback and discussion. Your planning team should help finalize and approve them, which will then help to determine the rest of the exercise details, including the scenario. For more information about developing your scenario, please see the Changing and Developing the Scenario webcast link. Please remember that you can send us feedback and questions anytime through the website.